Hello, I'm Dr. Karen Landers with the Alabama Department of Public Health, and today we're going to provide some basic information on the subject of anaphylaxis. Again, I'm an Assistant State Health Officer with the Alabama Department of Public Health and a pediatrician. This is a subject that is very important to me, not only from the medical standpoint, but also from the personal standpoint, as I had a relative to die from anaphylactic shock. Today we're going to talk about several objectives, one of which is to define anaphylaxis. In addition, we're going to outline the common signs and symptoms. We want to provide information about the risk of delaying the use of the epinephrine auto-injector, as we want to emphasize that being the most important action to take when a person has signs and symptoms of anaphylaxis. And we want to demonstrate one type of auto-injector, recognizing that there are other products on the market. However, we will demonstrate one product today. In order to receive a certificate for viewing this program, you have to review this video. You have to complete the anaphylaxis education form, which will be on the ADPH website, and you have to repeat this training every 2 years. Now let's talk about the subject of anaphylaxis. What is anaphylaxis? Anaphylaxis is a sudden allergic reaction involving the skin or the tissues of the tongue, lips, or throat, and either a breathing problem, low blood pressure, or another symptom. There are many causes of anaphylaxis, and these are some of the most common, specifically foods such as peanuts or shellfish, drugs such as penicillin, items such as latex products, including latex balloons, venom from insects, including bee stings or wasp stings. Exercise can induce anaphylaxis, and allergy shots can cause anaphylaxis. This is why your doctor, when allergy shots are being given, prepares to treat a potential allergic reaction in his or her office or site of the administration of the shots. So when we're talking about symptoms and signs of anaphylaxis, the skin is really one of the most important indicators. Persons who are developing an anaphylactic reaction may develop extreme redness or flushing, especially over the head and neck, wheals or hives, swelling of the lips or tongue, and itching. Again, these are what's called cutaneous or skin indicators. In addition, respiratory symptoms that can occur include a stuffy nose, throat swelling, unable to speak, a high-pitched cough, almost like barking of a seal, shortness of breath, which can lead to smothering and even death. Lungs, symptoms of the lung problems include wheezing, coughing, chest tightness, and can also lead to smothering and death. There are heart or cardiovascular symptoms. Persons with anaphylaxis can initially have a fast heart rate, or they can have a slow heart rate. They can also develop low blood pressure and shock. Again, these are signs that are a bit later in the onset of anaphylaxis. So when we see the early signs, we want to go ahead and intervene. Also, some persons with anaphylaxis symptoms can develop gastrointestinal or stomach and intestine symptoms such as nausea, vomiting, cramping, or diarrhea. Finally, there can be other signs that are seen sometimes with anaphylaxis, including, and this has been reported in adults, a feeling of impending doom after they have been exposed to the agent, after they have been bitten by an insect, or after they have ingested a food to which they are allergic. A sudden feeling of something not going very well and needing some help right at that moment. A taste of metal in the mouth, a metallic taste. An urgent need to go to the bathroom, or in women, uterine cramps. But again, the symptoms I outlined earlier are more common to be seen in anaphylaxis, but these symptoms can also be seen. Now, what are the factors affecting outcome in an anaphylactic reaction? Well, one of the first factors is that the earlier the onset of symptoms after exposure to the allergen, the more likely that that reaction will be severe. And it follows that the earlier the person has symptoms, the more quickly we should react. Quick is really the word of the day when it comes to responding to a potential anaphylactic reaction. Another factor that can affect the outcome of anaphylaxis, as I said earlier, quick being the word of the day, is the longer we wait to administer epinephrine, the more likely the person is to have a poor outcome or even death. That's why the availability of epinephrine to be administered quickly and get the person to medical help, all of these are extremely important in having a good outcome in an anaphylactic reaction. Also, anaphylaxis caused by injectable drugs, that reaction is more likely to be severe. And finally, patients that are on heart medicines such as beta blockers, patients with underlying other illnesses such as severe heart disease or severe high blood pressure may have a severe outcome. But the factors I mentioned earlier, again, rapid onset of symptoms and delay in providing the epinephrine are really extremely significant in helping us to have a good outcome instead of a poor outcome. Now let's talk about the first line treatment for anaphylaxis, and that is the epinephrine auto-injector. And the epinephrine auto-injector is a product that has been produced in order to provide a standard dose for treatment of a person with an anaphylactic reaction. And at this point in time, I want to demonstrate the epinephrine auto-injector. The first thing that we will do with the auto-injector is we want to remove the cap from the auto-injector. Then we want to grasp the auto-injector in our dominant hand, being careful not to put our fingers over either end of the auto-injector. In other words, not to inject ourselves with the medication. So again, remove the cap, making certain that we grasp in our dominant hand and do not put our fingers over either end. And then rapidly, we want to inject the medication into the thigh. So we will inject. You will hear a click. Hold the injector for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remove the injector, drop it, and rub the area where the medication has been administered for 10 seconds. Again, at this point, we've already given the medication. We want to go ahead and get that person to medical care. Now, on our mannequin, you can see that we do not have clothing covering the leg. However, the epinephrine auto-injector is manufactured to be able to be given through clothing. Certainly, if there are products in the pocket, such as a wallet or such as a key ring, we want to move that out of the way. But again, the epinephrine auto-injector is designed to be used through clothing so that we do not have to remove clothing from the leg. And again, clothing such as jeans, which are a little bit thicker, we do not have to worry about that interfering with the use of the epinephrine auto-injector. Once the injector has been used, again, the needle should retract back into the end, but we want to be able to take the product with the person to the hospital so that it can be disposed of safely. Now, we're going to review a graphic of the signs and symptoms of anaphylaxis. On our graphic, if you will look, you will notice that the symptoms that we see, again, the mouth, itching, swelling of the tongues or lips, lungs, shortness of breath, coughing, wheezing, skin, itching, hives, redness, swelling. With the throat, we can see itching, tightness of the throat, coughing. With the heart, we can see a weak pulse. As I mentioned, you can initially also see a strong pulse. Passing out, dizziness, and again, stomach or intestine symptoms such as nausea, vomiting, diarrhea, and cramps. Now, to go on to our next slide, we want to review the reasons for using the epinephrine auto-injector immediately. Epinephrine stops working in a few seconds, and again, I mentioned quick being the word of the day. Intervene quickly with the patient in order to reduce the risk of a poor outcome. Other medications that are used in anaphylactic reactions can take longer to work, and that's why epinephrine is our first-line drug. For example, antihistamines will take minutes to go into effect, and steroids will take several hours. So again, while these medications may be used and are used, epinephrine is the drug that we want to use first and we want to use quickly. Now, a facility that has epinephrine available through auto-injector to be given should have a plan. We should have a plan. Again, if we have a plan for this type of emergency, we're more able to confidently respond and help the patients. Again, the plan should include reviewing training materials such as these materials. We want to be familiar with the specific epinephrine auto-injector that is available. Again, I have shown one product today. There are other products available. They're very similar to this specific product. Again, with facilities having a plan, we not only want to outline immediate management, but we want to outline follow-up of the person requiring emergency treatment for anaphylaxis. Once this epinephrine pen has been used, the person needs to immediately be seen in a healthcare facility. They should not be driving themselves in a car to a healthcare facility. We should call 911. We should have that person transported or take the advice of our medical provider to get this person to a facility. Again, they should not be driving themselves if they are an adult. Now, individuals, again, patients with known histories of anaphylaxis to certain agents or patients that are at high risk for anaphylaxis should know their history. Again, know about the allergy history. Avoid that agent to the extent possible. Certainly, we may not be able to avoid every agent, but again, to the extent possible, if we know that our child has a peanut allergy, then we not only should educate our child once they're old enough to be aware of that themselves, but also be careful about the child going to birthday parties or to grandparents' house or to somewhere else where there might be peanuts available or peanuts in a product, and we do not know that, so we need to be extremely careful about that and have that child have an EpiPen available and persons able to use that. In addition, we need to know the signs and symptoms of anaphylaxis. And while I have reviewed those today, there are many other resources on the web from a number of different organizations, including the American Academy of Allergy, Asthma, and Immunology, as well as children's hospitals and companies that produce epinephrine auto-injectors. Again, I have reviewed a graphic today of this. We need to act quickly, and I cannot stress that enough, as the quicker we intervene to provide this medication that has onset in seconds will markedly reduce the risk of a person having a poor outcome. And again, have the epinephrine auto-injector available. Now, physicians generally recommend, I myself with my own patients recommend that 2 auto-injectors be available. And these products actually do come in dual packs. And I think it's extremely important to have 2 injectors available just in case the first injector does not decrease the symptoms as the person is either on his or her way to a medical facility or waiting for transport. Again, we need to know how to use the auto-injector, and while I have demonstrated this today, I would encourage that whatever product you have available for your child or your facility, that you go to the website of that company and review their information on use of their product. Again, finally, immediately seek medical help after using the auto-injector, but do not wait to use the auto-injector. If a person has signs or symptoms of an anaphylactic reaction, we need to go ahead and intervene because that really will make all the difference in the world. Finally, I have included a slide here on some expert references from physicians who are known to have published literature in this field. And just in closing, I would like to encourage people and remind people that should we have a situation where if you've reviewed this information and you have actually used your epinephrine auto-injector, that you come back to our website and provide us information regarding your use of the epinephrine injector and fill out the information that we will have on our website so that we can collect data and ensure that we can provide the best education, training, and outcome for patients who need this information. I'm Dr. Karen Landers with the Alabama Department of Public Health. Thank you very much for listening to this topic today.